Appendicitis and Differential Diagnoses, Abdominal Assessment. Introduction. Jerome Coffin is a 22-year-old male who has complaints associated with abdominal pain that started 8 hours ago. The pain is located around his navel and epigastrium. To conclude regarding the final diagnosis, it is important to identify differential diagnoses and focus on the abdominal assessment to confirm the conclusions. Differential diagnoses. Depending on the observed symptoms and signs, it is possible to determine the following differential diagnoses: appendicitis, acute pancreatitis, gastritis, gastric ulcer, and cholecystitis. The symptoms of appendicitis as inflammation of an appendix can include abdominal pain, nausea, vomiting, constipation, diarrhea, and fever. The symptoms observed in Jerome can also be associated with acute pancreatitis, which is characterized by abdominal pain, fever, nausea, and vomiting. The pain can radiate to a patient's back and depends on eating. Gastritis is an inflammation of the stomach that can have the following symptoms: nausea, vomiting, abdominal pain, indigestion, and loss of appetite. Gastric ulcer is a type of peptic ulcer characterized by stomach pain, loss of appetite, nausea, vomiting, and bloating. Cholecystitis also has symptoms related to the case: abdominal pain, tenderness of a patient's abdomen, fever, nausea, and vomiting. Final diagnosis and plan. The final diagnosis is appendicitis. The reason is that Jerome experiences pain that does not radiate to any other organ, it does not depend on eating, and its location in the abdomen is associated with appendicitis. The assessment demonstrates that Jerome experiences pain radiating to the right lower quadrant, and tenderness on palpation in the periumbilical area can be observed. The abdominal pain, which starts as epigastric pain and then radiates to the right lower quadrant of a patient's abdomen, is typical of appendicitis. At this stage, vomiting, nausea, and fever are not observed. Furthermore, changes in the level of leukocytosis noted concerning the results of the complete blood count test and neutrophilia are typical signs of appendicitis. Immediate surgery should be planned to remove an appendix. Assessment. While conducting the assessment of a patient's abdomen concerning auscultation and palpation techniques, it is possible to determine normal and abnormal findings. The results of auscultation indicate that decreased peristalsis can be observed, and there are no bruits. The presence of sounds associated with peristalsis is normal, and it is important to pay attention to their frequency and intensity. The absence of bruits is normal. During palpation, it is important to focus on examining tenderness and masses. The examined abdomen is soft, and it is normal. The presence of tenderness on palpation in the right lower quadrant and rebound tenderness are abnormal and require further examination. The absence of pulsatile masses, as well as abdominal guarding, and the absence of observed hepatosplenomegaly are normal signs. In this case, abnormal signs are associated with appendicitis. Conclusion. The conducted assessment of Jerome with the focus on the character of his abdominal pain and test results allows for speaking about appendicitis as the final diagnosis for this case. The conclusion is based on the analysis of symptoms, complaints, and findings of auscultation and palpation. For this case, immediate surgery can be discussed as an appropriate treatment option to remove the inflamed appendix.